Hey again, welcome to another section of Dr. K's 2023 ruminations on clinical imaging AI and the RSNA 23 takeaways. I want to spend some time here talking about a topic that is near and dear to my heart. I want to talk here about what is termed opportunistic screening. This is a term, I don't know if it was coined by, but definitely has been definitely taught and popularized by Professor Perry Pickhardt from University of Wisconsin. And he led, among other topics and sessions at the RSNA, a very nice workshop in a session on opportunistic screening and AI and implications, including speakers during the session, John Garrett from University of Wisconsin, Arun Krishnaraj from UVA, Bernardo Bizzo from MGH. But so opportunistic screening, what is it? How is imaging or other AI affecting it? And why should you care? So screening is probably a term we're familiar with. This is doing any sort of a test, a diagnostic test to tend to find the likelihood of a person of having a certain disease or a condition. But usually that screening is done intentionally, meaning that you have a high likelihood of cancer because you smoked 30 packs over 20 years, 30 packs a week, whatever the metric is. And so you're a higher risk pre-test of having lung cancer. And so it's been shown that getting low-dose CT screening can find nodules that are more indicative of being cancerous. So you do that screening by using the CT. Breast cancer, you get your annual mammogram for women, and there are different tests depending on the indication. So that blood test, lab test, or imaging test done to really determine and to find earlier diseases, usually cancer, the earlier stages. The opportunistic part of opportunistic screening means that we are going to see some findings in other studies, other tests, whether it's an imaging test or a lab test, but this is usually refers to diagnostic imaging exams in radiology and cardiology. You see a finding in that study that is not the primary purpose of why that study was ordered. And so that incidental finding, right, a secondary finding, may be life-threatening. We call that an urgent finding. That's not the topic of opportunistic screening, but rather the topic for AI used in this use case is there are different indications and different features that may be in that patient. A great example is for lung cancer screening, intentionally a patient getting lung cancer screening. If in that CT scan, the radiologist may notice that their heart is enlarged or there's calcification in the coronary artery. And so the state of as is the radiologist will mention that in her notes, and then you hope that the primary care physician or somebody else will see that, maybe call the patient, maybe to get an exam with the cardiology group, or now in the age of information sharing, right, that we can't block, the patient may see that themselves. They would then make an appointment. But with AI tools and automation that deep learning and the different technologies enable us to do is to make those findings in the background, maybe with the radiologist or cardiologist's consent, but nonetheless, these findings are flagged, and then by using other automation techniques and technologies, linking that finding to the ordering physician, downstream to other service lines if it's a health system, and making that patient get some additional testing or interventions earlier that may be life-saving. So the opportunistic part here is that we're taking the opportunity that you're getting a diagnostic test. You're getting, in the case of X-ray and CT, some ionizing radiation. Well, so now let's use these features that are found there that tend to correlate with risks that you do something with it.